Hello and welcome to the Rev Up Health podcast. Today we are going to be talking about hormones in midlife. And right now, menopause is getting lots of attention, and we love that. It's so important. Women's health has been grossly
neglected.
Yes. Yeah,
Very much so.
But I do think also that andropause, the male equivalent to menopause, there's a lot of parts to that have also been neglected. So today we're going to talk about, in general, hormones and how they change in midlife.
Yeah, and they're essentially the same. We're looking at something that, yes, they happen in the different sexes, of course, but, their symptoms are similar in some respects, but primarily their long-term symptoms can be similar. And that's really a very important thing, as we'll talk about today, actually. So
yeah, and I think one key difference to note, and the reason why menopause is getting so much attention right now, is that this change happens so rapidly and erratically for women, whereas with men, it's pretty much a slow
decline, right?
So it's kind of one of those things where you don't realize that you're not feeling the same because it's happening at such a slow rate.
Right. Yeah. And with andropause, kind of men are kind of complacent about our health to an extent too. So we need a little bit of encouragement to go understand why, we feel like we do. But it's also one of those things that, okay, is it just part of aging? Okay, it's just part of getting older. That's not an excuse. There's a reason for it. And there's causes, the root causes, and understanding why these things occur.
Yes. And I think the other thing that we want to focus on today is that this isn't just about hot flashes and low libido.
Right.
What you typically think of as menopause and andropause type symptoms, it goes so much deeper.
Right. I kind of like to separate these things up into, kind of a short-term and long-term type symptoms. So I hope this podcast today can be kind of more of a no frills, just kind of a straightforward dialogue that, people can maybe have a resonance with, so it can understand that, maybe I do have those symptoms, and okay, maybe I do need to check into this. And, so there are a lot of options, but with the short term, the symptoms, those are things like hot flashes, mood changes, vaginal dryness, low libido, erectile dysfunction, those types of things. But with long-term symptoms, these are the things that are down the line. This is stuff that takes years to occur and decades to occur. And these are things that are really important to everybody that is on their radar, and they're also quite scared of, but they don't really know why or how to avoid it to an extent. And what I'm talking about is things like, sarcopenia, just loss of muscle mass, essentially.
Which starts at the age of 30.
Oh, I know. It's incredible. And in some studies, you can say it even starts sooner than that, actually. But bone health and just cognition, those are the long-term things. In other words, just being able to have your wits about you, being able to come up with ideas and be creative and essentially be functional. So, but those long-term effects with, even with heart disease is something that's avoidable. So, but, basically we're talking about the essentials of just a few. We're just going to kind of keep it simple with, essentially we're looking at estrogen, testosterone, progesterone, and essentially also thyroid.
And vitamin D. Yeah. I really think that those are all of the things. Commonly, we think estrogen and testosterone when we think about andropause and menopause. And I think that it's really important to know that it's really the decline of all of these hormones and how they collectively.
And men and women, we all have estrogen and testosterone, it just in different various forms. But it's certainly something that yes, these declines slowly and steadily occur. And as they slowly decline, that's something that happens very subtly. And that's where it takes years and decades for these types of things to take effect on our body systems. So, but, in our younger years, in our reproductive years, yes, that's where we start seeing these declines in our sex hormone levels and general hormone levels also. But it's as they persist, into our older adult years, that's when we start seeing these problems with an increased risk of dementia or an increased risk of mood changes, heart disease, and that's where the low libido becomes into effect. And then osteoporosis and sarcopenia, the muscle wasting. But the osteoporosis is something that is very important and should be scary to an extent for people. So it obviously it occurs a lot more for women than men, but it does occur for both sexes. So, some of the other uncommon symptoms, they're linked to hormone changes, mental health variations. Those things occur. And, we're not just talking about depression and anxiety, we're talking about cognition, ability to remember, short-term, long-term memory, things along that line.
But I do think that it is really important to talk about depression and anxiety,
right,
because that is something that is not very well linked
right,
to changes in hormone health, and not just, our sex hormones. Thyroid there's been a lot of studies to show that resistant depression or chronic depression not helped with antidepressants could be related to your thyroid levels.
Right. And it's not, you may bring this up to your provider, your healthcare provider, and they may, okay, well, is there SSRIs, the antidepressants, anxiolytic medications and things? Yes, but there are alternatives. There are things that a person can do and or take that can help offset this or improve it or reverse it also.
Yes.
But, this typical decline in cognitive abilities can very well be linked to the menopause and the andropause to an extent with hormonal slow declines that we see.
And your lipid panel is another thing that is very closely related to the change in these hormones for men and women.
Right. So we're talking about something that, these types of hormonal deficiencies can lead us up to problems with insulin deficiency, insulin resistance, essentially, which can increase our visceral fat, subcutaneous fat. And then we can start having issues with the lipid profiles. And then, downstream effects of that are, yes, hypertension or atherosclerotic disease, so there's a lot of things that are linked indirectly that we just don't realize. And truthfully, from a medical perspective, as a physician, we weren't taught this stuff in medical school, and really not in residency. This is something that you learn in a postgraduate, out in practice type of setting. It's something that you want to have an interest in and understand why. It's that, okay, yeah, here's your high blood pressure medicine. Why is this? What can I do? And as a patient, and a physician, it's that question is why is this occurring, and what can we do to fix that? But even a decrease in thyroid function can affect, these types of things with our lipids. It's not just hypothyroidism. It's lower functioning, kind of a lower level of thyroid function that can cause these types of things even for us to occur.
Yeah, I think one of the things that we have learned is that you can have symptoms of thyroid deficiency without actually having a clinical diagnosis of hypothyroidism.
Yeah, the suboptimal levels, you need to have optimal levels. Well, there's cellular responses that need to respond to these levels of hormones. And if there's problems within the cells themselves to even see the hormone levels, then you may have a normal level in your bloodstream, but your cells aren't responding to that. So, and that's part of the why thing that we get into for individuals. Then we get into, sarcopenia, which is a huge thing, kind of a big topic right now, actually, for individuals. And that's essentially, muscle wasting. We have a lot of different options or ideas about it, but, you're looking at about a 2 or 3% reduction in your muscle strength and muscle mass per year. And as that continues, if we do nothing to try to improve that, it will continue. And this is going to lead to frailty. These are going to lead to problems where, we're just not able to hold ourselves up as we step off the curb or go down the stairs, or, if we trip, you don't have that muscle mass. And then we get to other conditions where fractures become a contributing, one of the leading causes, and we get older in adults to death. And it's really something that gets overlooked.
Yeah, I think this is one of the things that I would recommend to young people to pay attention to, is do that strength training. As a young person, you have so much more capacity to build muscle, and then it's easier to maintain as you age. Right. But I think that is something that oftentimes gets overlooked.
Yeah. And it's never too late. Never too late. Don't fall into the old adage that I'm old, I can't do that. Yes, you can. I'm sure people have seen on Instagram or online, you can see the older folks in their 70s and 80s that just simply have trouble going up and down off steps. And with time and perseverance and the right nutrition and support, then they can actually build that muscle. And it's something that, yes, you can do that. You can improve your muscle mass and your VO2 max, your cardiopulmonary aspects of life. And that's something that can be improved even in older age. But like you say, it's nice to maintain that. That's really important, is maintaining what we have and we're younger.
Yeah. And I think the connection between strong muscles and strong bones is something that needs to also be reiterated, because having strong muscles does increase your bone strength too.
Yes. Yep. That's going to increase bone density. It puts stress on those bones. And that's how we remodel. There's a buildup and a breakdown process. And that's how we have healthy bones. Yes, it needs to be built up, but that's part of the breakdown, is part of that process too. And so by doing those resistant trainings, by doing the plyometric type of activities, those are things that will help build that bone for folks.
And healthy levels of hormones also help that process.
Right. Yeah. That's the vitamin D. You got your proteins, the amino acids. You need to have that gram of protein per ideal body weight a day to try to maintain and hopefully improve muscle synthesis and production. So, but those exercises and training activities are what really helps a lot. Just being sedentary and complacent is not really going to be helpful. We have to move. So, but that bone health is so impacted with daily activities and hormone levels. The estradiol and testosterone levels and thyroid optimization is so important for those types of things. And then you get into the differences by, okay, well, how is this treated? What are the differences? I've gone to my healthcare provider and I just haven't gotten the answers. And maybe they're just kind of, okay, here's your medication. So, some of the difference we'll see is that with traditional conventional medicine, we are taught to identify a diagnosis for a patient and treat that disease, usually with pharmaceuticals. So
or surgical intervention.
Correct. Or surgical interventions, which is indicated for some situations. There's no doubt about that. I'm not against that. That is truly there.
And pharmaceuticals have their place.
Absolutely.
I think that it's oftentimes we've changed from a thought process of I need this medication to kind of get me through this season of disease that I have, to now we're thinking of I have to be on this medication for the rest of my life. And it's not always the case. Sometimes it is, but it's not always. And you won't know unless you start digging to find the root cause.
Right. Yeah. And there's a lot of ways to find those root causes, but that's where, a functional integrative medicine approach is different. It's just looking a little further into understanding why has it gotten to this point, and what's really the base root cause of the reason why I'm having these problems. So that's where we come into, or to that. So with our practice, we are focused on looking at those preventive or corrective things, whether it be through lifestyle changes or nutrition, environmental changes, but specifically about hormone optimization. We're able to help and guide folks through those problems and those questions that they have. So there's a lot of different ways a person, you don't have to take hormones just to improve yourself. There's lifestyle changes, nutrition changes that can happen. But sometimes we all just need guidance. Some people just need somebody to help hold them accountable for what they need to do to improve themselves. And they maybe just need direction on a kind of understanding of what's the most effective way an appropriate way to help improve this.
Yes. And I think also along with this guidance is the idea that helping the individual kind of get back in touch with their own intuition so that they can hear what their body's saying, because our body is always talking to us and letting us know what's going on and what it needs. We just have gotten disconnected from it. So that's another key part of the guidance that we can offer, is kind of helping you get back in control of your own.
The body is pretty smart. It's going to know what it needs, and we just need to learn how to listen to it. I mean, a lot of us realize and know that we need to do certain things, but sometimes we just need a little bit of convincing.
I mean, this is ongoing forever. It's the journey of life.
Right.
Really. But yeah.
This is true. But yeah, I think, looking at what we'd like to do, what Revelation Health KC is to try to look more of a holistic view, which can include a lot of different parts. But, looking at your muscle health, your bone health, let's improve cognition and just integrate, wellness practices that can help improve our midlife declines that want to happen. But, there's a lot of people say that, okay, well, I don't, this age thing and this, it's hard for us to cope with this, but you don't have to age as much as fast as you want to. So
or not as fast as you want to, as fast as you don't like. That you have to age as fast as you want.
Yeah, exactly. All right.
Well, that wraps up our conversation today. Please let us know if you have any other questions. We'd love to answer them for you.
Yep. Reach out. We hope you have a healthy day.